drug theory. It's just not a helpful way to look at it.
Thank you. Thanks very much. Okay, Dr. Eyolfson.
Thank you very much, Mr. Chair. Dr. Mate, I really appreciated your comments about having to think, what is the best science, but also you have to think politically. I'm a physician, but now, as you have probably guessed, I have to also think politically in my current job. So it was kind of amusing to think about that in the way that is part of our, the deliberations at this level. Now, one of the things you mentioned earlier, and we've had a lot of discussion about this, is that there are many people with pre-existing mental illness who then go on to develop a substance use disorder, whether that be cannabis, tobacco, alcohol, or anything. Do you believe that if we had better investment and commitment into primary mental health care, and we're more effective at treating people at the primary care level, would that be helpful in primary prevention of a lot of drug use disorders?
Well, absolutely. I mean, in almost in every case of substance use, you can identify something that's present. Often ADHD, and I talk about ADHD because I've been diagnosed with it myself and I know a little bit about it. But also depression, anxiety, post-traumatic stress disorder, social phobias, bipolar disorder, which typically is self-medicated with alcohol. So in a lot of cases of substance use, there's a pre-existent mental health problem. And not only that, of course, as some of my colleagues have pointed out, the drugs then themselves can either cause or exacerbate mental health problems. So there's a strong correlationship, both in cause and effect. So that from which it would follow the pertinence of your comments, which is that better mental health treatment, particularly amongst adolescents and children, would tend to reduce drug use. That's what my belief is, and it makes sense for all kinds of reasons. Now, the broader question, again, which I've raised a couple of times, not to be answered in this context, is what is it about our culture and our way of life that's driving more and more people? Like, why are studies in Canada and the States every year show more and more kids who are suffering from symptoms of mental health disorders of all kinds? So there's something's going on here, and that's a broader social question. But specifically when it comes to mental health treatment, yes. If in the schools we had better recognition of mental health problems, if we recognize that many of the behavioral problems that we're seeing are actually manifestations of inner turmoil, if the schools, for example, could act as screening venues for identifying kids at risk, and we could do this much more broadly on a community basis as well. The more we did this, I think the less substance use we would have to confront.
All right, thank you very much. Now, Dr. Davila, we talked about impaired driving due to cannabis. And I agree, certainly in not just in my experience talking with my patients, but going back to when I was in high school in the 1970s, yes, I'm that old, there was that belief that there was nothing wrong with driving on it. There were people I knew who would smoke it, and they swore that their video game scores improved after smoking up, so driving must be okay. People have always believed that nonsense. Now, we know that there have been a lot of ads on drunk driving, and by a lot of metrics, they've been pretty effective in getting the message across. MAD, particularly, Mothers Against Drunk Driving, have been one of them that have some very, very powerful and effective ads. Are we overdue in getting the same message about driving while impaired on cannabis into these ads, and perhaps putting that in the same context, and might that have a little more credibility now that we're dealing with a legal product the way we are with alcohol?
Well, I would like to think so, and I would agree that, as I mentioned in my remarks, injury and motor vehicle accidents actually are related to that, are the main contributor to the burden of illness associated with cannabis right now in this country. So, might those education campaigns, help? Yeah, I think that's part of it. And I think there are, again, there's a whole series of or elements that are required in an education campaign, impaired driving being one of them. We've heard from other panelists here, or witnesses, that in fact there's other topics of conversation, like trying to ensure that our young people do understand that the earlier they start and the more they use, particularly if they start early, the more likely they are to suffer longer-term consequences. So, but by the same token, I think we heard from my colleague here to the left that there's lots of use amongst youth. We have to try to, again, a wise thing to do, as is the case with virtually every drug, is how do we adopt, one, a preventive approach, and two, where it is being used, a harm reduction approach, right? Minimizing the harms associated with the use of that substance, whatever it is, at both the individual level and ultimately at the social level.
Time's up.